Hello everyone, I'm Katarina Hänninen from the Turku University Hospital in Finland. I'm here to present our study, Propensity-matched comparison of early intensive and escalation treatment strategy in Finnish MS patients. Here are our disclosures. In current MS treatment strategies, high-efficacy DMTs, meaning disease-modifying therapies, as first-line treatment are often reserved for patients with high disease activity. But in patients with average disease activity, the high-efficacy therapies are traditionally used only after unsuccessful treatment with moderate efficacy first-line DMTs. There is emerging evidence that early intensive treatment could be associated with reduced long-term disability. So our objective was to determine the effectiveness of early intensive treatment versus escalation treatment on disability outcomes in Finnish MS patients. This was a retrospective propensity-matched register study. We identified relapsing-remitting MS patients from the Finnish MS registry and divided them into two groups. The early intensive treatment group included patients who were initiated infusion therapy as first-line treatment, and the escalation treatment group included patients initially treated with injectable therapies, teriflunomide or dimethyl fumarate. Here are the primary outcomes, and disability was determined by EDSS. Nearest neighbor propensity matching was performed for these variables, and odds ratio for disability progression at 3 years and survival analysis of time to disability progression was determined. After propensity matching, both groups included 55 patients, and here are the baseline demographics of the patients in the groups. And here are the treatments used. As you can see, in the early intensive treatment group, natalizumab was the most used DMT, and in the escalation group, most patients were receiving interferon beta. So the odds ratio for disability progression at 3 years in the early intensive treatment group was 0.5. And median survival time to disability progression in the escalation group was 74 months, but not available in the early intensive treatment group because less than half of the patients progressed. And here is a Kaplan-Meier analysis showing the time to disability progression, which was longer in the early intensive treatment group. So we conclude that early intensive treatment resulted in a lower risk and longer time to disability progression than escalation treatment strategy. Thank you for your time.